Well, my name is Daniel. My first name is Daniel, and Bob is my household name. Jones is my surname, so I'm called Daniel Bob Jones, and I'm living in CPG community. Well, the ward that I'm living in presently is Ward 432. I'm living in the central part of the Freetown. In central part of Freetown, it has 9 wards, so I'm in one of the 9 wards in Freetown. Well, I'm part and parcel of various organizations in my community. First of all, I am a CDMC chairperson, which is the Community Disaster Management Committee at community level, and I have been partnering with all the various kind of CBOs, for example, the federations of the urban and rural poor, and also I have played a role there to establish many more kind of CDMC in different communities, over 108 communities that I have been to establish and do other kind of work with those guys. Well, presently in my community, at community level, what we do is to engage community stakeholders with the CDMC members and other CHW, because now for now we are having a epidemic issues, which is health related issues. So definitely, and health related issues also related with disaster management affairs. So we have to get on board also to know and how to prevent and raise awareness to our people, so that we have been working hands in hand to see how we can mitigate all those kinds of risks that are forming in our community for now. We definitely have a cordial relationship with all these kinds of structures that existed in the community, because we do meet in a meeting and discuss as to where and how to target any kind of outbreak. So that has been, an understanding, a co-understanding between us also, so that we can know when and how to see we can go about and raise the awareness and know when and how to sensitize our people as to how to fight against the COVID-19 that has been affecting our people definitely. Well, most of the changes that have been taking place is somehow like my guys and I, both of us has been definitely on our feet day to day, sensitizing our people, raising awareness, telling them how to social distance themselves, and then how to use the face masks. That has been some of the changes that actually affect people, because the social kind of way we usually do things, we limited that. Not playing football, not going to the nightclub, not those who are experiencing or do an exercise of religion or worship together, they do stop for a while. Where people used to go to get their living, they do stop it for a while, and then coffee limited people not to do things as usual. Those who usually do their fetish trading at night, they cut it down. So that acts also, disturb some kind of way how people will be able to earn their living. It disturbs them a lot, definitely. The first thing when we get the state of emergency announcement since March 31st, we were part of the community that even got the COVID, let's say patients that we are very fast to respond to that, because we have an organized responders in the community, which are always volunteering to do to before the government intervention. In fact, and most of our guys were there promptly to see how to social distance themselves, or even to take the people who are now considered to be a COVID patients, how to quarantine, give themselves quarantine before government interventions. And some were there, in fact, afraid of being to say yes, they are going to be targeted because of they are living in the community or they live in the same house that they have got the patients. But we were there to caution them that they should stay put, and then they will take them to a particular location, and then begin to sensitize our people to say if they heard of any other someone who is living within their midst, maybe of COVID-19, to reach the health center. Also, we were having a triage home to stay them there for a while until government can get attention towards that. I think we were doing that. Well, my first response was about 205 people. Some were taken to the Mariam Hotel, somewhere in the community. And again, I have another 12. Again, I have another 5 right here in Collector presently that I'm looking at.